This past Friday, a California coroner officially ruled Robin Williams' death a suicide, and now we're learning specifics about what may have led the Oscar-winning actor to hang himself in August. His widow, Susan Schneider, said Williams had Parkinson's disease, but a pathology report reveals he also suffered from Lewy body dementia. That's the same disease radio icon Casey Kasem had before he passed away in June. With me now to talk about this, Dr. Devi Nampiaparampil, assistant professor of anesthesiology and rehabilitation at NYU School of Medicine. Dr. Devi, this is obviously a man that I think so many people had warm feelings for and were entertained by. And so there are a lot of questions when we learn about really additional information here, this Lewy body dementia. What is it exactly?
Well, Lewy body dementia is very similar to Parkinson's, so you can have some of the same problems with your movements and some of the same problems with your thinking. I mean, there's some overlap with Alzheimer's, but one of the things that makes it difficult to tell is that, really to be able to tell the difference, you might get a brain biopsy to take a look at what the brain looks like under the microscope. But there's not really a good advantage to doing that because since we don't have a cure for Parkinson's, since we don't have a cure for Lewy body dementia, why put someone through those risks? So you try to manage the symptoms.
Yeah, I mean, you can imagine the risks with a brain biopsy. The coroner's report, Dr. Devi says that Williams had a, quote, increase in paranoia. Where would that come from? Would that be from the Lewy body dementia?
It could be. It could also be from the medications that you usually use to manage these things. So to really understand, I mean, Lewy body dementia is very similar to Parkinson's in that people have a problem controlling their movements. So if you've ever potty trained a child, if you've ever tried to train a pet, what you do is when you get the behavior that you want, you reward it, right? And when you see something that you don't want, you don't give it a reward. So the brain does the same thing with your movement. So let's say that you want to walk across the room, your brain gives you a reward chemical called dopamine. And when you do something that you don't want, you don't get dopamine. So in Parkinson's and Lewy body disease, the problem is that you don't have enough dopamine and it's not really managed properly. So that's why people, let's say they're trying to walk or they're trying to talk or they're trying to do something that requires muscle movements. If they don't have dopamine, then they have a hard time doing it. So people with Parkinson's tend to have problems moving. Now, they also can get rewarded with this chemical for movements that they don't want, like a tremor, which is why you see abnormal movements sometimes. So it's really a problem in terms of regulating the movement. Yeah. Now, when you take these medications, the other problem that happens is that this medication actually can cause hallucinations. So, people take the medication. It's a miracle drug for some because it allows them to be able to do those movements that they want. So it allows them to talk, interact with their family, do different things. But the problem is you can't totally control where it's going to end up. So if you take it by mouth, it can work on other parts of the brain where you really don't want it to work, and it can cause hallucinations. Now, Lewy body dementia itself can cause that problem as well because you can't regulate that chemical. But those could be factors that contributed here.
Could there be a confusion between the Parkinson's disease and between Lewy body dementia? Because, like you said, you don't really know if a patient has Lewy body dementia most times until they passed away.
Exactly. I mean, there is confusion because in Parkinson's, you can also see Lewy bodies. Now, Lewy bodies are little kind of microscopic sort of deposits that end up in the brain. And we're not sure exactly what their function is, if they're just kind of debris, like your brain is taking out the trash, or what they are. But you can see them both in Parkinson's and in Lewy body dementia. The only difference is really with Lewy body dementia, you see some things that are also very similar to Alzheimer's disease. So again, because we don't have a cure for Alzheimer's or for Lewy body dementia or Parkinson's, we don't really do a lot of invasive things to try to figure out the difference. We kind of look at the symptoms that people have in these diseases and try to control the symptoms to make them feel better.